In the procedure we're going to do today, we're going to replace a posterior amalgam on a maxillary second premolar with a unique resin that actually is a very dense, almost like packable resin, until you place a sonic energy on the resin, which makes it like a flowable. This material has very low shrinkage, which means we're not concerned about, when we polymerize it, breaking the dent and bond. Secondarily, it has a 5 millimeter depth of cure. That's 2.5 times what we see with most of our composites on the market. So we're not going to incrementally fill. We're not going to use a flowable because, as you see this material, as soon as I put my foot on the rheostat and it comes out the tip, it acts like a flowable. And so we have great adaptation at the floor of the box, which we were always concerned about that. Great adaptation against the walls of the preparation, the gingival floor, the pulpal floor, and against the matrix band. So we put the tip in, just like as we do an endo-type fill, at the base or the floor of the box. If you're doing a class 1, it would be on the pulpal floor. As we extrude, and you can see it's very flowable, as we extrude it through the tip, we just lift the tip out of the box. So we're basically backfilling it. Once we fill it, and you can see it here, now this flowable composite, now that the sonic energy is taken away, now it becomes like a very dense condensable. And you can see we can actually condense it or pack it, almost like an amalgam. It's totally different than any of the other resins we use on the market that are available. We can condense it, we can carve it. You can see how fast that filled up. It was less than probably 30 seconds, and it completely filled the cavity preparation. Now I'm going to carve the excess. You can use a half Hollenbeck or whatever you like to kind of shape your marginal ridge. And then we can light cure. You know, the curing lights we have now, especially the plasma arc, and I'm using the Demi Plus from Kerr, and they have a greater depth of cure. They're more powerful, quieter, lighter than the plasma arcs that people said were so great several years ago. These are great lights, so make sure you have a good light. You know, in summary, you saw how easy it is. You saw how dense it is. We don't have to worry about air voids, or as we pack multiple layers, creating air voids. We're not using different materials, first a flowable, then another material. It's time saving. In fact, I've probably spent more time talking about it than it actually took me to do the cavity preparation and the placement. I mean, typically I tell people under 3 minutes and closer to 2 minutes on these MODs, DOs, or MO restorations, and you can see how nice this restoration looks.